welcome back to another episode of Coffee Time. And today I am sitting with Senior Admissions Representative Tony Kelm. Cheers.
Cheers.
Thank you for being here. What do you do here at NWHSU? Let's start with that.
My main purpose is to recruit students and help them transition into our academic programs.
Okay, and how long have you been at the university?
So I'm just finishing up my 11th year.
Wow, that is a long time.
Yeah.
So it's going well?
It is going well, yes.
And what's kept you here? What's the most rewarding part about your job?
I think it's the campus community, the people that make up this campus. The admissions office, we have to work with a lot of different departments. And here at Northwestern, we just have great people that work in all the different departments. It makes our job a lot easier.
Right.
And it makes me a lot more confident that the students are going to have a great experience while they're going to school here.
That's great. Yeah, it is a really, really great team, and I agree. The admissions team works so well with all the departments and getting everybody involved in the process of bringing a student in and taking them, through their whole journey here. And so you work with prospective students. You do a lot of different things. You travel, right? You do tours on campus. Tell me a little bit about your day-to-day.
Yeah, it can be different depending on the different time of year. Like you said, we do a little bit of travel. So we'll travel a little bit in the fall and we'll travel a little bit in the spring. And we get to go out to different colleges, community colleges, universities, and really talk to students in their environment about our academic programs. So we'll do, presentations and have talks and things like that. Most of my time is spent on campus, and like you said, we'll get to do some tours when students want to come and actually visit our campus, which is a great opportunity to take them around campus and really show them the highlights of Northwestern. We're a resource for prospective students, so we constantly get phone calls, emails, text messages.
People still call on the phone, old school?
Yeah, some people still call.
Okay, good
on
to
the
know.
Phone. Yep. For the most part, we get text messages and emails overall. But yeah, that's kind of what we do on a day-to-day basis, is really respond to the email, phone calls, text messages that we receive.
So you're part of the journey from when someone shows an interest in the university, in a program right away, and they're working through getting to know the campus, getting to know the program, applying, and starting, right? That whole journey, that's you helping them out.
Yeah, and for some programs, it's quite a long time. Sometimes for the chiropractic program, we'll get students that are interested in our chiropractic program when they're in high school.
Wow.
And they still need to go through undergrad before they start chiropractic school. So it can be a long process for them as far as being, in contact with us for 4 or 5 years long.
Okay, yeah.
Where other programs, they might request information 3 months before they want to start our program. So it's pretty short process for some students. But yeah, we pretty much, once they show an interest in our program, we start the communication with them, and then we take them through the process of, answering their initial questions to get them interested in applying to our program. Once they submit their application, getting them through the application process, and then the enrollment process once they decide they want to come and attend Northwestern. And then we get them to new student orientation, where our great student affairs office kind of takes over at that point.
Good. They're in good hands along the way. And what would you say is the main thing that brings the students to NWHSU?
Well, I think the biggest thing that I see is that students that are interested in our academic programs as a health sciences university, they really want to help people.
For sure.
That's their number one goal. And a lot of them see themselves in healthcare helping people directly. Mm-hmm. And so, we do get some students that are straight out of college and start our programs, but we also get a lot of students that are, changing careers. And they're changing careers from where they don't have that instant impact directly with people, and they want that. And that's what they really want to come and obviously get a degree so that they can work in that field. Yeah.
You said you do tours on campus, right?
Yeah.
Okay. Is there a specific point of the tour or a specific part of campus that you yourself are super excited to show off? Or talk about, or
Well,
like highlight? Maybe it's program specific?
it is very program specific because we do cater our tours to each academic program here at Northwestern. So for instance, like the chiropractic program, I think the force sensing table
Yeah.
lab is
It's a
really,
highlight.
is pretty good highlight. They really like that. They like to learn about that, and that's something that they're going to start utilizing pretty early in the program too. So it's not like you're showing them something that they have to wait 2 years to utilize in the program.
Cool.
Overall, you know, acupuncture I would say is the herbal lab.
Yes, true.
On campus,
It's-
like their eyes light up when they walk into that herbal lab.
It's pretty cool. It looks like something out of Harry Potter, something like that.
It is pretty cool, and so we definitely make it a point to stop in there for sure. And what the really cool thing about our herbal lab is that normally there's students or faculty in there, and so they get to interact with those students and faculty as well.
Nice.
While they're in there. But yeah, I mean, for the most part, I would say the lab areas are the most attractive just because they can see themselves
In that space.
in that space while they're a student on campus. But generally speaking, I think that the clinics are very impressive overall for our students to see, like, okay, yeah, I'm actually going to be working in a real clinic environment when I start my internships.
Right, and get that hands-on, personalized attention pretty much right away.
Yeah.
Cool. So you've supported so many students, as we spoke about, in transitioning into their degrees here, whether they're doing a doctorate degree or just an associate's degree. What are some of the best pieces of advice you share with students over and over again?
Some pieces of advice that I share with students is start the process early. It's going to make it a smoother transition for you overall. So that's probably one of the things that I share with them the most. But I think the biggest thing for our programs is to be committed to the program. I do see a lot of students that, you know, they are kind of on the fence and if they really want to pursue this or not. And like when you start our programs, you have to be ready to go from day one.
They're rigorous, right?
Yeah, rigorous. You know, you know, there's no transition,
slow, easier way into
time
it.
into it and that type of stuff. So
Right.
You have to be committed, and so you know, we make sure in the admissions office that we let them know that.
Yeah.
Before they come for new student orientation, which is usually the day before classes begin.
So they feel prepared. They know what to expect in terms of the workload, in terms of the schedule, and just the flow and everything. Like you guys are preparing them for that.
Yeah, we try to prepare them as much as possible.
Right.
For sure. That's kind of like our job for the student is to prepare them for what to expect in the program.
And give them
overall.
resources as
Yeah.
well, financial aid, housing, all of that too, or is that more student affairs?
No, we do. We'll connect them with our financial aid office if they have any questions about financial aid. If they have any questions about housing, you know, we can provide some resources for them to find the appropriate housing options that they're looking for. We have a really great housing website that has a lot of resources on there for them. So, yeah, I mean, it's definitely it's not just the academics; it's also
The living in Minneapolis,
yeah,
right?
it's life as a college student
Yeah.
overall and that type of stuff. So yeah, that is what we try to do for our students. Yeah.
Great. Well, I have one more question from you. I'm sure you get to hear so many stories of how future students want to change healthcare. Like we mentioned, they want to make an impact in their fields and they want to help people. Do you have a good example of a student who you got to watch do exactly that as they graduated? You've been here 11 years, so I'm assuming you maybe have a few.
Quite a few stories. You know, I remember this one student, you know, she really wanted to work with like people that were like low income, providing services where it would be like reduced costs
Sure.
and things like that. And she actually worked at a clinic that offered those services, and she was told by that practitioner that she would be able to take over that clinic if she
Oh.
graduated from our program.
Oh, wow.
It's just things like that where people are very like specific on who they want to impact,
Where they see themselves.
but giving back to their community that
Yes.
they got initially.
Yeah.
I remember one student was talking about that He came from a very rural area that didn't have these services available, or not many in the area, and wanted to bring that back to his community.
Right.
So a lot of it is the students really want to be the next expert bringing back healthcare to their communities that they grew up in.
Right. That's so amazing. Well, thank you so much for sharing these stories and for being here on Coffee Time. Thank you, Tony. Cheers.
Thanks.